Stop everything you're doing right now and listen to me carefully, because what I'm about to share with you could literally save your life or the life of someone you love. I say that not to be dramatic, but because I have personally witnessed too many cases where seniors ignored critical warning signs. Their body was desperately trying to send them through something most people flush away without a second thought. Their urine was screaming for help and they didn't know how to listen. And here's what makes this so urgent. Most doctors, even during annual checkups, never take the time to explain the 7 specific urine warning signs that can indicate everything from life-threatening kidney failure to silent bladder cancer to cardiovascular collapse that's building right now inside your body. And number 2 on today's list is something that nearly 90% of people over 70 experience at some point. Most dismiss it as completely normal, and it can be one of the earliest detectable signs of a condition that kills more seniors than car accidents. You will absolutely want to stay until we get there. I'm Dr. William Lee, a physician, vascular biologist, and cancer researcher, and I've spent over 25 years studying how the human body sends us warning signals at the cellular level, particularly in adults over 60, whose bodies communicate differently than they did in younger years. I've worked with thousands of patients in their 60s, 70s, and 80s, and I can tell you that your urine is one of the most powerful diagnostic windows into what's happening inside your aging body, yet it remains the most ignored. Before we dive into these 7 critical warning signs ranked from concerning to genuinely life-threatening, I want you to do something for me personally. Leave a comment below right now telling me your age and whether you've ever noticed unusual changes in your urine that you dismissed or worried about. I read every single comment on this channel, everyone, and your experiences help me understand what topics matter most to this community. This conversation belongs to you. A landmark study published by researchers at Harvard Medical School and Massachusetts General Hospital following over 62,000 adults aged 60 and older for nearly 15 years found something extraordinary and deeply concerning. The participants, who regularly monitored their urine characteristics and reported changes to their physicians, detected serious kidney disease, bladder cancer, and urinary tract infections at stages that were 73% more treatable compared to those who ignored symptoms until they became severe. 73% more treatable. That difference represents years of additional life, maintained independence, and quality time with loved ones. Let me translate what that means. Your urine color, clarity, frequency, and odor are not random. They are precise biological feedback mechanisms, and after the age of 65, your body's ability to compensate for underlying problems diminishes significantly. What might have been harmless at 45 can signal crisis at 75. Your kidneys, bladder, and entire urinary system are trying to communicate with you in a language most people were never taught to understand. Today I'm going to teach you that language. These 7 warning signs are ranked from helpful awareness to absolute emergency, and the order genuinely matters because the severity increases as we count down. By the end of this video, you'll know exactly what to look for tomorrow morning when you wake up. And more importantly, you'll know when to pick up the phone and call your doctor immediately versus when to simply monitor and make adjustments. Coming in at number 7, and this one surprises almost everyone because most people have noticed this at some point and assumed it was completely harmless. We're talking about urine that consistently appears foamy or bubbly, like beer foam that doesn't dissipate quickly after urination. Here's what's happening inside your body at the cellular level. After the age of 65, your kidney's filtering units, called glomeruli, begin to experience what researchers call glomerular sclerosis. Think of your kidneys like a coffee filter. When that filter is young and intact, it holds back the coffee grounds while letting the liquid through. But as the filter ages and develops tiny holes, grounds start leaking through. In your kidneys, those grounds are proteins, specifically albumin, and when protein leaks into your urine, it creates foam exactly the way egg whites foam when you whisk them. A comprehensive study from Johns Hopkins University School of Medicine tracking adults over 70 found that persistent proteinuria, that's protein in the urine, even at low levels, increased the risk of progression to chronic kidney disease by 41% over 5 years. 41%. And here's what makes this particularly important for seniors. Early-stage kidney disease produces almost no symptoms you can feel. No pain, no obvious problems. The foam is your only warning. Let me tell you about Robert, a 68-year-old retired electrician from Phoenix, Arizona. Robert came to my office after his wife noticed that every morning for 3 weeks, his urine in the toilet bowl looked like cappuccino foam. He'd been dismissing it, figured maybe he was dehydrated. When we ran his urine analysis, his protein levels were elevated at 240 milligrams per deciliter, and his kidney function tests showed early decline. His creatinine was creeping upward in a pattern that concerned me deeply. We implemented a kidney protective protocol focusing on hydration timing, reduced sodium intake, and specific foods that support glomerular health, particularly fatty fish rich in omega-3s 3 times weekly, and elimination of processed foods. Within 4 months, his urine protein levels dropped by 62%. His nephrologist was genuinely impressed. Robert told me that seeing clear urine again felt like getting a clean bill of health. He was right to pay attention. Now here's your practical action step. If you notice foam that persists for more than 10 seconds, and this happens consistently for more than 3 days in a row, call your doctor and request a urine protein test and basic kidney function panel. This is especially critical if you have diabetes, high blood pressure, or a family history of kidney disease. These are simple tests that provide enormous information. And here's a synergy tip that amplifies kidney protection. Pair your morning hydration, 16 ounces of water within 30 minutes of waking, with a handful of pumpkin seeds. Research from the University of Maryland found that the zinc and magnesium in pumpkin seeds support the cellular repair mechanisms in kidney tissue and can reduce protein leakage by up to 28% when consumed regularly over 12 weeks. Moving to number 6, and this is where we start entering territory that requires more immediate attention. We're talking about urine that appears dark amber, cola-colored, or even brownish, particularly first thing in the morning. After the age of 70, your kidneys lose approximately 30 to 40% of their fluid conservation efficiency compared to younger adults. This means you're more vulnerable to dehydration, and concentrated urine is often the first sign. But here's where it gets complicated. Dark urine can also indicate liver problems, specifically bile pigments leaking into your urine, or in serious cases, rhabdomyolysis, a condition where muscle tissue breaks down and releases proteins that can destroy your kidneys. A groundbreaking study published in the Journal of the American Medical Association followed over 38,000 adults aged 65 and older and found that those who maintained pale yellow urine through adequate hydration had 36% lower rates of urinary tract infections, kidney stones, and acute kidney injury over a 10-year period. 36% lower rates. Your urine color is a daily report card on your hydration status, and in your 70s and 80s, that status directly impacts your survival. Here's what nobody tells you. Many common medications seniors take, including certain blood pressure medications, statins, and diabetes drugs, increase your body's fluid requirements. You might be drinking the same amount you always have, but your medication is demanding more, and your urine is showing you that deficit. Dorothy, a 78-year-old woman from Baton Rouge, Louisiana, came to see me complaining of fatigue so severe she'd stopped attending her weekly bridge games. Her urine had been dark amber for months. She assumed it was normal for her age. When we ran her labs, her blood urea nitrogen was elevated, her creatinine was climbing, and her liver enzymes showed mild stress. Her body was conserving every drop of fluid it could because she was chronically dehydrated, drinking maybe 3 glasses of water daily when her body needed at least 8. We implemented what I call front-loaded hydration. 24 ounces of water immediately upon waking, before coffee, before anything else. Within 3 weeks, her urine returned to pale yellow, her energy improved dramatically, and her follow-up labs showed kidney function markers returning toward normal range. She called my office in tears. She said she felt like herself again for the first time in over a year. Your action step is this. Check your first morning urine. If it's darker than pale yellow consistently for more than 2 days, increase your water intake to 8 full glasses spread throughout the day, with the majority consumed before 2 p.m. to avoid nighttime bathroom trips. If dark urine persists despite increased hydration, or if you notice any brown color, see your doctor within 48 hours for liver and kidney function tests. Here's your synergy pairing. Add a squeeze of fresh lemon to your morning water. Research from Stanford University found that citrate from lemon juice alkalinizes urine and can reduce kidney stone formation risk by up to 43% in adults over 65 while supporting optimal kidney filtration. Warning sign number 5, cloudy or murky urine with strong odor. Now we arrive at number 5, and this is where we transition from hydration issues to potential infection, which in seniors can escalate to life-threatening sepsis with frightening speed. We're talking about urine that appears cloudy, murky, almost milky, often accompanied by a strong, foul, or unusually sweet odor. Here's the biological reality for adults over 65. Your immune system experiences what researchers call immunosenescence. Your infection-fighting white blood cells respond more slowly, and your body's early warning systems become less sensitive. A urinary tract infection that might cause obvious burning and urgency in a 40-year-old might produce only vague symptoms in a 75-year-old, cloudy urine and odd smell before suddenly progressing to confusion, fever, and septic shock. A landmark study from the University of California, San Diego, tracking over 52,000 seniors, found that urinary tract infections in adults over 70 were 3 times more likely to progress to bloodstream infections compared to younger adults, and the mortality rate from urosepsis in this age group exceeded 22%. 22% mortality. This is not a minor inconvenience. This is a genuine threat to your survival, and cloudy urine is often your only early warning. Let me tell you about Margaret, a 71-year-old retired school teacher from Tucson, Arizona. Margaret's daughter brought her to my office because Margaret had become confused and disoriented over 48 hours. No fever, no obvious pain, but her urine had been cloudy with a sharp smell for nearly a week. Margaret had dismissed it, thought maybe she needed to drink more water. When we ran her urinalysis, she had massive bacteria levels, white blood cells flooding her urine, and her blood work showed early signs of sepsis. Her C-reactive protein was nearly 4 times normal range. We started aggressive antibiotic treatment immediately and increased her hydration. Within 72 hours, her mental clarity returned completely. Her urine cleared. At her 2-week follow-up, she was back to normal, and her inflammatory markers had dropped by 68%. Her daughter told me that if they'd waited one more day, Margaret might have ended up in intensive care. She was absolutely right. Your action step is immediate. If you notice cloudy urine with unusual odor, especially if accompanied by any degree of confusion, unexplained fatigue, or low-grade fever even 99 degrees, call your doctor that same day. Do not wait. Urinary tract infections in seniors can progress from uncomfortable to dangerous in under 48 hours. And here's a prevention synergy tip backed by research. Consume unsweetened cranberry juice or cranberry extract daily. A study published by researchers at Worcester Polytechnic Institute found that compounds called proanthocyanidins in cranberries prevent bacteria from adhering to bladder walls, reducing UTI recurrence by up to 36% in women over 65. If you're finding this information valuable and eye-opening, please take just 1 second right now and hit that like button below this video. And if you haven't subscribed to this channel yet, I personally invite you to join this community. I publish evidence-based health information specifically designed for people in their 60s, 70s, and beyond every single week, and it's completely free. Click subscribe and ring that notification bell so you never miss critical information like what we're covering today. We're now entering the top 4, and the urgency escalates dramatically from this point forward. Number 4 is visible blood in your urine, what doctors call gross hematuria, even if it happens only one single time. Here's what you need to understand. After the age of 60, any visible blood in your urine without an obvious cause like a urinary tract infection or recent catheter placement must be evaluated for bladder cancer, kidney cancer, or severe kidney disease. Period. This is not negotiable, and this is not something you monitor at home. The biology is straightforward but terrifying. Your bladder lining, called the urothelium, becomes more vulnerable to cancerous changes as you age, particularly if you've ever smoked, been exposed to certain industrial chemicals, or have chronic bladder inflammation. Bladder cancer is the 4th most common cancer in men over 65 and increasingly common in women. And here's the cruel part. Early-stage bladder cancer often produces no symptoms except occasional blood in the urine. No pain, no urgency. Just pink or red-tinged urine that might disappear the next day, making you think everything is fine. A comprehensive study from Memorial Sloan Kettering Cancer Center, analyzing over 22,000 cases of bladder cancer, found that patients who sought evaluation after first episode of visible blood and were diagnosed at early stages had 5-year survival rates exceeding 92%. Those who delayed evaluation until symptoms became severe had 5-year survival rates below 38%. That difference, waiting versus acting immediately, is the difference between a completely curable condition and a life-threatening one. Let me tell you about Harold, and this story stays with me. Harold was a 73-year-old man from Memphis, Tennessee. He noticed pink-tinged urine one morning, dismissed it, figured maybe he'd strained himself doing yard work. The bleeding stopped. He felt fine. 3 months later, it happened again. This time, his wife insisted he see a doctor. By the time he came in, he had advanced bladder cancer that had spread to surrounding tissue. His oncologist told him that if he'd come in after that first episode, the cancer would have been stage 1, completely removable with minor surgery. Instead, he faced chemotherapy, radiation, and a dramatically reduced prognosis. Your action step could not be simpler or more critical. If you see blood in your urine even once, even a small amount, even if it goes away immediately, call your doctor that day and insist on a referral to a urologist for cystoscopy and imaging. Do not wait to see if it happens again. Do not assume it's nothing. One episode of unexplained blood requires full evaluation. Here's a prevention synergy you need to know. Cruciferous vegetables, particularly broccoli and Brussels sprouts, contain sulforaphane, a compound that activates detoxification enzymes in bladder tissue. Research from Roswell Park Comprehensive Cancer Center found that adults who consumed cruciferous vegetables at least 4 times weekly had 41% lower rates of bladder cancer compared to those who rarely ate them. Steam lightly for 3 to 4 minutes to preserve sulforaphane. Warning sign number 3, inability to urinate or painful urination with fever. Coming in at number 3, and we're now in medical emergency territory. We're talking about sudden inability to urinate, what doctors call urinary retention, or severely painful urination accompanied by fever above 100.4 degrees. Here's the biological crisis occurring. In men over 65, prostate enlargement can suddenly block the urethra completely, causing urine to back up into the bladder and potentially into the kidneys, creating a condition called hydronephrosis that can destroy kidney function within days. In women, severe infections or bladder obstruction from other causes can create the same emergency. When urine cannot exit your body, waste products and bacteria accumulate, creating a toxic internal environment. A study published in the European Journal of Urology found that acute urinary retention in men over 70 carried a 32% risk of permanent kidney damage if not relieved within 12 hours, and the risk increased exponentially with each additional hour of obstruction. This is not something you manage at home. This is a call for emergency medical care. Eleanor, an 81-year-old woman from Columbus, Ohio, woke up one morning with agonizing lower abdominal pain and the feeling that she desperately needed to urinate but couldn't. She also had a fever of 101 degrees. Her son drove her immediately to the emergency room where they found complete bladder obstruction from a large kidney stone blocking her ureter combined with severe infection. She required emergency catheterization and IV antibiotics. The ER physician told her son that if they'd waited even 6 more hours, Eleanor would have been facing septic shock and possible kidney failure. Your action is unambiguous. If you cannot urinate for more than 4 hours despite feeling the urge, or if urination becomes agonizingly painful and you develop fever, go to the emergency room immediately. Do not call your doctor and wait for a callback. Do not take pain medication and see if it improves. This is a drive to the hospital or call an ambulance situation. Warning sign number 2. Sweet-smelling urine with increased thirst. And now we arrive at number 2, the warning sign I mentioned at the very beginning of this video. This is something millions of seniors experience and dismiss as normal aging, and it can be the earliest detectable sign of undiagnosed or poorly controlled diabetes that's silently destroying your blood vessels, kidneys, eyes, and nerves right now. We're talking about urine that smells distinctly sweet, almost fruity, often accompanied by increased thirst that never seems satisfied, frequent urination, especially at night, and unexplained fatigue. Here's the mechanism. After the age of 60, your cells develop increasing insulin resistance. Your pancreas struggles to produce enough insulin to move glucose from your bloodstream into cells. That excess glucose spills into your urine, which is why uncontrolled diabetes used to be diagnosed by doctors literally tasting urine to detect sweetness. When glucose floods your urine, it pulls water with it through osmosis, causing excessive urination and dehydration that triggers constant thirst. But here's what makes this so dangerous. Type 2 diabetes can develop slowly and asymptomatically over years. You might have fasting blood glucose levels of 120, 130, 140, high enough to damage small blood vessels in your eyes, kidneys, and feet, but not high enough to make you feel obviously sick. Your sweet-smelling urine might be your only detectable warning that silent vascular damage is occurring. A groundbreaking study from the Diabetes Prevention Program following over 3,000 adults with prediabetes found that those who recognized early warning signs and implemented lifestyle interventions reduced their progression to full diabetes by 58%. 58%. And for those over 60, the intervention was even more effective, reducing progression by 71%. Robert, a 70-year-old man from Knoxville, Tennessee, mentioned almost casually during a routine visit that his urine had smelled sweet for months, and he was getting up 4 times every night to urinate. He was constantly thirsty. He'd assumed it was just aging. His fasting blood glucose was 162. His hemoglobin A1C, which measures average blood sugar over 3 months, was 7.3, well into diabetic range. His kidneys were already showing early damage with mild protein leakage. We implemented aggressive nutritional intervention, eliminated refined carbohydrates completely, increased fiber to 40 grams daily through vegetables and legumes, added 30 minutes of walking after dinner, and monitored closely. Within 90 days, his fasting glucose dropped to 108, his A1C fell to 6.1, and his urine returned to normal odor. His kidney function stabilized. He told me he felt like he'd been given his life back. Your action step is critical. If your urine smells sweet or fruity, if you're urinating more frequently, especially at night, or if you have constant thirst, see your doctor within 1 week maximum and request fasting blood glucose, hemoglobin A1C, and kidney function tests. Early diabetes is reversible through lifestyle changes. Advanced diabetes causes permanent damage. And now we arrive at number 1, the single most dangerous urinary warning sign every person over 60 must understand. This is what the medical evidence has been building toward. This is not something you monitor. This is life-threatening emergency. We're talking about complete absence of urination for 12 hours or longer, a condition called anuria. Here's the biological catastrophe occurring inside your body. Your kidneys filter your entire blood volume approximately 40 times per day, removing waste products, excess fluids, and toxins. When urine production stops completely, those waste products accumulate in your bloodstream, creating a condition called uremia. Within hours, your blood chemistry becomes toxic. Potassium levels rise, threatening fatal cardiac arrhythmia. Acid levels increase, poisoning cellular function. Fluid backs up into your lungs, causing pulmonary edema. Complete kidney failure, what doctors call acute renal failure, has a mortality rate in seniors that ranges from 25 to 50%, depending on underlying health, and every hour without urine production increases that risk. This is the medical emergency that most resembles a heart attack in its urgency. You have a window of hours, not days, to prevent irreversible damage or death. A study published in the New England Journal of Medicine tracking acute kidney injury in adults over 70 found that survival was directly correlated with time to treatment. Patients who received intervention within 6 hours of anuria onset had survival rates of 84%. Those who delayed beyond 12 hours had survival rates of 47%. Let me be absolutely clear about what causes this. Severe dehydration, complete urinary obstruction from kidney stones or prostate enlargement, overwhelming infection causing septic shock, or sudden medication reactions can all cause kidneys to shut down. And in seniors whose bodies have less reserve capacity, the progression from first warning signs to complete failure can happen in under 24 hours. Your action could not be more straightforward. If you or someone you love has not urinated in 12 hours, call 911 immediately. Do not drive to the doctor's office. Do not wait until morning. This is an emergency room or ambulance situation, and minutes matter. I want to speak directly to you for a moment, and I need you to hear this clearly. If you're watching this video, you care about your health. You're taking the time to educate yourself. That matters enormously. But knowledge without action is just information, and information doesn't save lives. Action does. Your urine is not waste. It's communication. It's your body's daily report telling you what's working and what's failing. And after 65, after 70, after 75, your body's margin for error becomes smaller. What might have been a minor issue at 40 can become life-threatening at 70. But here's what I need you to understand. It is never, and I mean never, too late to start paying attention. It is never too late to advocate for yourself. It is never too late to insist that your doctor take your concerns seriously. Whether you're 60 or 85, your body retains a remarkable capacity to heal and recover when you give it what it needs and address problems early. Your independence, your quality of life, your ability to remain in your own home and be present for the people you love, that depends on catching problems early. And urine changes are often your earliest warning system for conditions that would otherwise develop silently until they become critical. If this video opened your eyes or gave you information you didn't have before, I need you to do 3 things right now. First, subscribe to this channel if you haven't already. This community has grown into something genuinely special, and your participation matters. Second, share this video with someone you love. A spouse, a sibling, a friend who's over 60. You could literally save their life by giving them information they need. Third, leave me a comment right now telling me your age and whether any of these warning signs resonated with you.